Get this. By 2050, dementia cases are projected to skyrocket, like a staggering 150 million worldwide.
Wow.
It's a huge global health challenge.
Yeah.
And right now,
Right.
treatment options are really limited.
Sadly, yeah.
So what can we do?
Well, that's where prevention and
Yeah.
and understanding risk factors becomes super important.
Okay.
You know, we need to be proactive, especially when it comes to things we can control.
Okay, so let's unpack this.
Yeah.
2 new studies are really making waves. One, a large population study from Sweden, published in Neurology.
Okay.
And the other, a meta-analysis of 7 different studies published in renal failure. Both point to acute kidney injury,
Right.
AKI,
Yeah.
as a possible risk factor for dementia.
It's interesting. It's fascinating how both studies, despite their different methodologies,
Right.
kind of reached a similar conclusion.
Yeah.
The Swedish study, followed a huge group of people, while the meta-analysis combined data from multiple studies
Right.
to get a broader perspective.
So this isn't just a random blip, like the
Okay.
evidence is mounting.
Yeah.
And this is a call to action for all of us, I think, on the
Yeah.
front lines of healthcare.
Yeah, definitely.
Especially when you consider that the Swedish study found
Yeah.
that having AKI nearly doubles a patient's chances of developing dementia later in life.
And to be precise, they saw a 49% higher rate of dementia in patients with a history of AKI.
Wow.
And the meta-analysis showed a similar trend, almost a 2-fold increase
Yeah.
in the risk of cognitive impairment, including dementia,
Right.
after AKI.
Yeah,
So those are not numbers we can ignore.
definitely not.
Yeah.
Here's where things get really interesting.
Okay.
The Swedish study also found that the severity of the AKI matters.
Right.
So the more severe the AKI,
Yeah.
the greater the risk
And of development.
dementia.
Yeah.
And AKI acquired in the hospital, as opposed to out in the community,
Yeah.
seem to carry a higher risk as well.
Think about what that means. The context of the AKI
Right.
might actually influence its long-term impact on the brain.
Yeah.
So this opens up a whole new avenue of thinking about, like, preventative care for these patients.
Now, it's important to note
Yeah.
that both studies looked at different types of dementia.
Uh-huh.
They found that AKI was linked to an increased risk of several,
Right.
including Alzheimer's disease, vascular dementia,
Yeah.
and dementia with Lewy bodies.
And you know what's particularly striking?
What's that?
The Swedish study found the strongest association
Okay.
between AKI and dementia with Lewy bodies,
Interesting.
as well as Parkinson's disease with dementia.
Now, for our listeners who might not be as familiar with dementia with Lewy bodies,
Yeah.
it's the one where folks can experience
Yeah.
vivid hallucinations, often visual ones.
Right.
So imagine seeing things that aren't there. That's one of the hallmark symptoms.
And this specific connection to AKI could be because of the damage to the brain's dopamine pathways,
Right.
which are essential for both movement and cognition.
Yeah.
So it's like a double whammy, affecting both physical and mental function.
So we've got this potential link between AKI and dementia, and it seems to be especially strong for certain types of dementia.
Yeah.
But what does this actually mean for us
Right.
as healthcare providers?
Yeah.
Especially those of us
Right.
working with patients every day.
Yeah.
What are the practical takeaways here?
Well, this research is kind of a wake-up call.
Right.
It's telling us that we need to start factoring in a patient's history of AKI,
Okay.
even seemingly minor episodes, when assessing their overall risk for dementia.
Got it.
Early intervention is key,
Yeah.
and this knowledge gives us a powerful tool to be proactive with our patients.
So taking a detailed AKI history should be standard practice.
Right.
Just like we ask about, family history of dementia
Uh-huh.
or heart disease.
It's about adding another layer of understanding to our patient assessments.
Yeah, absolutely.
Yeah.
And it underscores the need to closely monitor cognitive function in patients who have experienced AKI,
Exactly.
even if it was a mild or single episode.
Right.
We can't just assume everything will be fine.
No, we need to be vigilant.
That raises an important question.
Yeah.
How do we approach these conversations with our patients?
Right.
AKI isn't exactly something people, chat about over dinner,
No.
but we need to make them aware
Yeah.
of these potential long-term risks.
It's about having those open and honest conversations,
Oh, yeah.
explaining the connection between AKI and dementia in a way that's clear
Yeah.
and understandable.
Right.
It's about empowering them with knowledge,
Yeah.
not instilling fear.
Right, we need to strike that balance.
Yeah.
Explain that AKI, especially severe,
Mm-hmm.
or hospital-acquired AKI might increase their risk of developing dementia later in life.
Right.
Emphasize that it's not a guarantee,
Exactly.
but a risk factor they should be aware of.
Yeah.
Especially if they have other risk factors, like high blood pressure or a family history of dementia.
Absolutely. And this knowledge can be empowering.
Right.
You know, it might encourage them to take steps to, mitigate their overall risk.
Okay.
Like managing their blood pressure, maintaining a healthy weight, incorporating physical activity.
Right.
These are things we should be recommending anyway.
Right.
But this connection to dementia kind of adds another layer of urgency.
So it's about reinforcing those healthy habits and showing them how these seemingly small changes can have a big impact on their long-term health.
Huge impact.
For both their kidneys and their brain.
Absolutely, for sure.
Now, I know we've talked about the importance of monitoring and having those conversations with patients.
Right.
But are there any specific actions we can take when it comes to prevention?
Yeah.
What can we do to really make a difference for these patients?
Like we mentioned earlier, a lot of it boils down to managing those modifiable risk factors, blood pressure control, weight management, and regular physical activity.
Right.
These are all crucial for our overall health, but maybe even more important for someone who's had an AKI. We need to be really diligent about, helping patients understand this and make those lifestyle changes.
So it's about going beyond just handing them a pamphlet.
Totally.
Right. And really working with them to develop a personalized plan they can stick with.
For sure.
But are there any AKI-specific strategies?
That's a great question.
Right. Things we might not typically think about in the context of dementia prevention.
While we need more research in this area, optimizing post-AKI care is a key consideration. For example, ensuring patients are adequately hydrated.
Right.
Avoiding medications that can put extra stress on the kidneys. And addressing any underlying conditions that might have contributed to the AKI in the first place. It's about taking a holistic approach to their care.
So it's not just about treating the AKI in isolation.
Right.
It's about looking at the whole patient.
Exactly.
And addressing all potential risk factors.
Yes.
Both for their kidney health and their long-term brain health.
Precisely.
I see.
And I think medication management also plays a crucial role here. The Swedish study did adjust for various medications in their analysis. But we need more research to fully understand how different drug classes might affect cognitive outcomes in patients with a history of AKI.
So some medications could potentially increase the risk, while others might actually be protective.
It's definitely worth investigating.
That's fascinating.
For example, we know certain types of anticholinergic drugs can have negative cognitive effects. It'd be interesting to see if those effects are amplified in patients who've had AKI. Could adjusting their medications help protect their brain health? It's a question we need to answer.
That opens up a whole new avenue.
Totally.
For personalized medicine.
Absolutely.
Imagine if we could tailor medication regimens to not only protect kidney function, but also support cognitive health. Especially in these vulnerable patients.
That's the goal.
Wow.
And I think this research is pushing us in that direction. It's forcing us to think beyond the immediate impact of AKI. And consider its long-term consequences for different organ systems, including the brain. It's a shift in perspective that could be game-changing for our patients.
It really highlights the interconnectedness of the human body.
Absolutely.
What happens in one organ system
For sure.
can have ripple effects throughout the body. And we need to be aware of those connections.
We need to be thinking about those connections.
Absolutely.
And it all comes back to that crucial point of early intervention. The sooner we can identify and address potential risk factors, the better our chances of preventing those long-term consequences.
So it's not just about treating the AKI, it's about what happens after.
Exactly.
Follow-up care.
The follow-up care is so important.
The lifestyle modification. The careful medication management.
Absolutely. The medication piece is huge.
It's about being proactive. and giving patients the tools to take control of their health.
I completely agree.
Yeah.
And this is where, research is so vital. We need more studies to dig deeper into the mechanisms behind this link between AKI and dementia.
Okay.
Why are certain types of dementia more strongly associated with AKI?
Yeah.
Can we develop targeted interventions, but with medications and lifestyle changes to effectively prevent cognitive decline in this high-risk group?
It feels like we're on the cusp of something really groundbreaking.
Yeah.
And it's exciting to think about the potential impact
Yeah, it's really kind of
this research could have on our patients' lives.
This research has opened a door to a whole new way of thinking about AKI and its long-term implications.
And it's up to all of us as healthcare providers, researchers, and advocates to walk through that door and see where it leads.
Absolutely.
We need to keep asking the tough questions.
Yep.
Pushing the boundaries of knowledge and striving to provide the best possible care for those who rely on us.
This is a call to action for everyone involved in healthcare.
We hope you've gained valuable insights today that you can take back to your practice.
Take them back and use them.
And remember, this research isn't just about numbers and statistics. It's about real people.
Real people.
Our patients.
And their future.
Their future.
We urge you to review the full studies.
Please do.
Acute kidney injury and its association with dementia and specific dementia types from neurology, and association of acute kidney injury with the risk of cognitive impairment or dementia from renal failure.
Yes.
To learn more about this groundbreaking research.
It's groundbreaking. We've included the full bibliographical information in the description.
Check it out.
Until next time.
Yes.
Keep diving deep.
Deep.
Disclaimer and bibliography in the description.